Thank you for joining us. It's really great to see you all, and we're looking forward to sharing with you what we do. So, as you know, COP26, the Conference for the Parties for the United Nations Framework Convention on Climate Change, what a mouthful at this time of the morning, is imminent. And it's a big event because it's clearly following up from Paris and the commitments there to limit global warming. But we're really thrilled to be with you today because it's the first time that health has actually been a science priority for COP. And we've all been very active as organisations. And when we were talking to each other, we've now learned and understand what we all do because we work closely together. But we realise that so many people that we work with are not very clear about what each of us as organisations do. But more importantly, how you can all work with us. So what we're going to do is rapidly give each of our organisations 5 minutes to tell you who we are or who they are, what they do, and how you can work with them. So I'm absolutely delighted to hand over to the first speaker from Healthcare Without Harm, who's going to talk about the Nurse Climate Challenge, Anna Furman. Over to you, Anna.
Thank you very much for the introduction, Fiona. Yeah, I'm here today to tell you about the Nurses Climate Challenge, which is a project of Healthcare Without Harm Europe. And we actually just started that this January, so it's all fresh and new and already, well, quite successful, I have to say. Could you go to the next slide?
Sorry.
Seem to have some technical troubles. If you'd like me to, I can also share the presentation.
To be honest, I think that might be best. My internet is not loading, it's just stopped loading the presentation. So I think that's probably a much better idea.
Okay, well, not to worry. If I could ask Rachel to get the slides ready for loading for the next speaker, that would be fantastic. So Anna, back over to you.
I hope you can see the slide in presentation mode now.
Yes, looks fantastic. Great. Thank you so much.
Perfect. So the idea behind the Nurses Climate Challenge is basically that healthcare professionals have a role to play against climate change. And we are very, very trusted. Like I'm a nurse as well, so I know the feeling of people listening to you and actually trusting what you're saying, especially when it comes to health impacts of climate change. And that's actually something in all countries around the world, not only in the UK. Nurses are and always have been one of the most trusted professions. And also nurses are the ones who care for patients all through our lives in all settings, may it be in the hospital or in home care. And that's why it's important for nurses to understand how climate change affects human health, but also how healthcare affects emissions and climate change. Then to work to decrease those impacts on the environment and prepare the patients who are at risk, because often we take care of the ones who are most vulnerable already. The goals of the Nurses Climate Challenge are, first of all, to educate health professionals on climate change and health, then build a cohort. And that's something that I find very important because sometimes it feels like we're all working in silos and we're all doing alone and there's nobody else to support us. And I think it's so supportive and so helpful to know that there's others out there who also think this is a real issue and that we have to do something. And then obviously at the end to have a movement of health professionals who are committed to create solutions for the problems that we see. So it's important not just to look at the problems, but also to find the best way to deal with those problems. To help with that, what we're doing is we're creating resources for learning. So like basic resources on how climate change impacts health of different patient groups and how we are impacting climate change with the resources and energy we use in healthcare. And then we create resources for education, so presentations for teaching other healthcare professionals, but also especially nurses. And then we have resources for advocacy, hoping that the nurses that participate talk to their own hospital leadership, to their administration, or even to their local community or politicians to change the things that need changing. And then last but not least, the practice, because as we know, healthcare is quite energy intensive and creates a lot of waste. And it's important to change the practice of healthcare and create new guidelines and projects that, well, show how to solve those issues. The idea behind it is that we collect basically the number of people that have been educated by the Nurse Climate Champions. So nurses can come and sign up for the Nurses Climate Challenge and then submit education activities. We have now, that's actually just a week ago, but we already have 800, I think nearly 80 nurses educated or healthcare professionals educated by the Nurse Climate Champions. And important to know, it's not only for the UK, but there's nurses from all across Europe that are participating, and even a few from South America, Africa, Southeast Asia, India. So it's a huge, like more outside of the UK movement. But I think that's also important that we connect, because there might be a nurse in Finland who has a great idea of how to solve a certain problem in plastic waste in the OR, and it would just be, yeah, it would be good to use all the ideas and all the case studies and all the solutions that we can find from all around the world, except instead of like focusing on only one small region. And that's our newest project. We just started the nursing school commitment, because it's important that not just the already registered nurses are learning about climate change and about sustainability issues in healthcare, but I think it's super important that it's already part of the curriculum when we start learning being a nurse, not only in the bachelor's, but also in master's or in even higher education. So the idea of the nursing school commitment is that nursing schools or faculties can sign up and pledge to change their own curriculum and include the knowledge about climate change and planetary health, and also include the practical skills that nurses need to implement new projects or change the practice of nursing. At the moment, we have 10 schools from all across Europe, and 2 of them are from the UK. Very short presentation, but if you have any questions, just send me a message. I'm very sorry I can't stay for the Q&A this morning, but I'll be there this evening.
That's great, Anna. Thank you so much. And we'll make sure that you see any questions that you get asked. But thanks so much. Rachel, are you able to share the selective slide set for everybody? And then while you're doing that, I will welcome our next speaker, who is Rhiannon Osborne from Students for Global Health, who's going to talk about climate justice.
And Rhiannon, I think your slides aren't on this set anyway, so if you want to just go ahead.
Yeah, I was just going to share them myself.
Fantastic. That's great. No problem.
Okay. So can you all see my screen? Okay, great. Yeah, so I'm Rhiannon. I'm a medical student in my 5th year, and my colleague Mark is going to be doing the presentation this evening. And I'm going to be talking a bit about the work of Students for Global Health and why it's really important for health professionals to take a broader intersectional lens when it comes to working on climate. And I'll signpost some resources as well for people who want to look this up, because this will be a bit of a whistle-stop tour. So a bit about Students for Global Health. So we're a youth network working on global and local health inequalities across the country. We have, I think it was 36, I think it's now 37. We have a new one this year, branches across the country at different universities. And it's not just medical students, it's basically any students who are interested in health. But a lot of our contingency are medical students, nursing students, global health students. And we focus on kind of education, advocacy, and mobilizing our members around different topics that impact global and local health inequalities. And one of our main areas of focus is climate change. So this is some of the work that we have been up to in the last year. And I won't go through all of it because I'm not sure that'd be very interesting for people. But in summary, kind of what we work on, we do a lot of campaigning. But I think something that it's important to highlight about our campaigning is we try to campaign in solidarity. And what that means is that we try and lend our voice to people who are running campaigns on, say, green jobs or economic inequality and access to high quality jobs, or campaigners who are already working on low quality housing. And what we do is we kind of bring the health element and the kind of climate and health element to those campaigns, and we look at how we can support people working on that. So if people are campaigning on insecure housing, we look at how we can build a health narrative that supports things like retrofitting as part of climate action that would also benefit people in insecure housing, for example. And we work with Indigenous groups in Malaysia, for example, to take their perspective on how the climate crisis is impacting their health and amplify it in the UK context, in particular in the lead up to COP26, where many of them aren't going to be able to get there. So that's a lot of how our campaigning works. So we quite rarely start our own campaigns. We do research, do a lot of research on youth and climate and health, but I won't go into too much detail, but we have like a nice youth survey. So if anyone's under 25, hit me up and we've got a nice survey for you to do. And we also work on getting climate change onto medical school curriculum and nursing curriculum and basically any curriculum at your university. We have lots of stuff helping to get it on there. But I think instead of talking so much about what we've done, I think it would be good to maybe highlight what we've learned and like kind of lessons for people wanting to do advocacy on this topic. I think as kind of a science-based profession, we really like to think that, oh yeah, if we create enough awareness about the climate crisis, everything's going to be fine. But actually, climate crisis is completely about politics and power and money. And as healthcare professionals, we are not trained in that. We are not trained in how to mobilize. We're not trained in the history of social movements. We're not trained in politics and power. So a lot of our work has actually been about doing education around that, because a lot of people come to us saying, like, we actually know quite a lot about the climate crisis, but we don't know how to organize, what to do, how to overcome the power of, say, high-income country governments or oil companies who really don't want action to be taken. So a lot of our work has been around meeting that need. And a lot of our work has also been around recognizing that, yes, like health professionals are experts in health, but we might not necessarily be experts in the climate crisis and the realities of what that means for communities. And what I mean by that is that as a profession, we're actually quite late to the game when it comes on acting on climate, and the experts are, for example, the communities in Nigeria who are currently facing really low life expectancy and like actually murder in many cases, where oil companies want to extract oil from where they're living, or Indigenous activists who are having their lands taken to make space for industrial agriculture. So a lot of our work has been recognizing that, yeah, okay, we know a lot about health, but we don't necessarily know a lot about that, and kind of being humble in the way that we talk about the climate crisis. And another thing that we've worked on is making it easy for people to get involved meaningfully. So yeah, making sure people sign petitions and stuff, but can they set up a local group and work together and kind of build that deeper organizing? So yeah, those are just some things that we learned. And I'm going to do a super quick whistle stop tour. I don't want to take too much time, and people can always like message me afterwards. But I think in terms of how we take this forward as health professionals, it's really important that we take a justice issue, both when it comes to climate and to health, right? Because those are kind of that's the fundamental reality behind most of these challenges that we're facing. So the kind of fundamentals of climate justice would be that high income countries and corporations are overwhelmingly responsible for the climate crisis. So that's on a global scale, but also on a local scale, high income households in the UK, for example, have significantly higher emissions than low income families. So it's really important to take that lens, because also these are the people who are going to be most affected by the climate crisis. So it's kind of the dual of being least responsible and most impacted. And again, this comes down to kind of power and inequality and wealth inequality as well. And then the same kind of applies to health. And I think, yeah, lots of people are also talking about health inequalities in the health movement, which is really great, but we need to link it to climate change and link it to broader inequalities in power. So the climate crisis worsens health inequalities, but also the causes of the climate crisis are often directly the causes of health inequalities as well. So if we look at lack of access to public transport and reliance on fossil fuel powered vehicles, that has a massive impact on the quality of people's lungs in that local area. So it's really important to link it explicitly. But also kind of the broader drivers of both the climate crisis and health inequalities are a lot of kind of bigger economic issues. Sorry, Fiona, I'm just about to finish. So basically, in summary, we need to demand system change as healthcare workers. And if you want to get involved in doing that in the next couple of weeks, come and join a protest. So we have a protest going on. The Global Day of Climate Justice is on November the 6th in the middle weekend of COP. And we have health blocks at each of those protests all over the country. So wherever you are, there'll be one probably within about half an hour of you at the most. So you can do that, and I'll send the details in the chat. You can also come to our online hearing on the 7th, where we're going to be hearing from communities most affected by the climate crisis about how it's impacted the health of them and their communities. And after COP26, because the climate crisis will not be solved at COP26, sorry to say, so we need to continue to call out UK government hypocrisy as the health professionals and make sure that they are acting on science, not words. And we have a campaign to do that on their new oil field. So I'll put that in the chat, and thanks so much, and sorry maybe for going a bit over.
Fantastic, thanks so much, Anya. And if you could also share the link to the Green Survey, that would be brilliant. People have asked for that in the chat, so that's a really good example of how you can engage in action now. And as Anya said, really important that we keep momentum going after COP26, because it's going to be important, but it's only a milestone in a much longer journey. So Rachel, we're ready for you now. Thank you very much. You're on mute at the moment, Rachel. Brilliant. You managed to move it on then, the slides, that is.
I think I had to come out of there. Is that, can you now see?
We can see you, and so
Okay.
maybe if you go into your own slide set, it looks everybody as if.
That's good. Yeah.
Yep, that's good.
Great. Okay.
You are ready.
Cool.
Go.
Hooray. It's a bit of a scramble. Sorry, everybody. Good morning. My name is Rachel Steincliff, and I'm the director of the Centre for Sustainable Healthcare. And we are a smallish charity based in Oxford, UK, been working since 2008 with many of you. And we try, this is our overall goal, is to demonstrate climate leadership by making sustainability an integral part of clinical culture and service provision. So we've basically made it our main focus to work with clinical and other healthcare professionals. So we work with things that are already in the system, so things like quality improvement and management and culture, and we try and embed sustainability in all of those. So obviously sustainability, these three things of social, economic and environmental, and we have tried to integrate them into healthcare education. So these are some of the things that we think are transferable to other countries. So we've worked with the General Medical Council in the UK to integrate sustainability into as many places as we can within the system, within the curriculum, and within the things that people are asked to include in their curriculums, because lots of medical schools are different. Obviously, they have their own curriculums. So how do we do that? We have a Sustainable Healthcare Education Network, and that involves a lot of different people working from other countries, a lot of people in the UK, and we map what's there already. We examine where to include sustainability best. We include students in strategizing, and we do what we can to change that curriculum. We also, as I mentioned earlier, we look at what the opportunities are for change within practice, clinical practice. So many of you will have heard of quality improvement. So it's this idea that basically we do things already, but we need to be reassessing what we do all the time and looking at how we can improve things. So again, a point for change within the system, and we've tried to include sustainability in that. So going back to that first simple diagram of what we call the triple bottom line: environmental, social, and financial impacts. What do we want? We want best outcomes for patients and populations, but we have to take account of this resource use. And this is our way of looking at sustainable value. We have ways of including practicing clinicians on the ground, such as our Green Ward competition. So we've worked with lots of hospitals in the UK. And again, it's a very transferable model to other countries. It's a simple way through a competition of people within one hospital or one trust competing with one another. And they do stuff, we help them to measure it, help them to make the change. And this is one case study that comes out of that. So one of the good things is that once you start measuring things rigorously, you'll get some good data, which again can be shared and used as evidence for other people in other places. So in this example, I won't go through all of this, but you can see that the cannulation was reduced by about half, and the cost reductions were significant, about £27,000 over a year. And this is just in one place. And obviously we're more interested in the carbon footprint, again, significant reductions. And in terms of the triple bottom line, you can see that staff time and patient experience were both improved, which is what we call the social element of the triple bottom line. So basically, we want to do more of these things. We want to measure them and we want to share them. So we did this piece of work with, we started working in kidney units a long while back, and did some measuring and wrote this article showing that the NHS could save £1 billion by scaling up the stuff that we'd shown could work in kidney care. So there's lots of this information out there already. As Rhiannon was saying, it's not necessarily that we don't have the information, it's much more about how we share it, how we make those changes within our systems. We also run nice green space for health programs, projects, and really we had this idea of the NHS Forest right at the beginning. It was a way of engaging healthcare professionals and others within the hospital setting with the importance of climate change by engaging them with what's immediately on their doorstep in terms of the environment. So very simple project. But it's been a really lovely thing to do all along, and especially in COVID times, it's been an important way of engaging and getting people to get outside. So if you want to learn more, we run courses in small groups, including these ones here. We're adding to them all the time. Many of them are done in partnership with some of your organisations. So we'd love to see you there and look forward to meeting you more. Thanks very much.
Great, Rachel. Thank you so much that you've done. Brilliant, and really good to see how you're working with people on those courses in the Green Ward and Forest. I'm going to share my slides now and tell you a little bit about the Centre for building on the Centre's work. So I'm Fiona Adshead. I chair the Sustainable Healthcare Coalition. I'm a doctor by professional background, and when I worked in government, one of the things that really struck me was that we needed to work in partnership with the private sector, because if it's a system problem, we need to involve everybody in the solution. Our coalition was actually set up by our National Health Service here in the UK, because they realised that about 2/3 of their footprint is actually in their supply chain, and that they needed to work really with companies to work out how to solve this problem. So what are the things that we've done? Well, the first thing we did was that we really wanted to work out how you carbon footprint products and services. It's a fundamental building block so that we can understand what we prescribe. And as we all know, healthcare happens at that interface between the clinician and the patient. And so if you can't quantify what that interaction is, just as Rachel was saying, you can't really move the agenda forward. But once we looked at products and services, we then realized, in fact, that we needed to look more broadly at the pathways in which patients were cared for. So again, we work with health professionals, with the NHS, and with colleagues in America and other health systems to actually come up with a care pathway. And what it is that we break down, as you can see in the bottom right, different elements of patients' journey through the system so that we can quantify them. On our website, we've now translated that into a care pathways calculator, which you can have a look at. And we've also published a number of case studies where we've used these care pathways with companies and also with others to really look at how we can reduce environmental impact and improve health outcomes, as Rachel was saying, by designing health in and environmental impact out. And so, for example, we've looked at how you can use digital and smart technologies to reduce environmental impact through supporting patients on the journey and providing information and support for clinicians. That's just one example, but we've got many others. But what have we really learned from this? Well, I think we've learned that if we get people together to try to solve problems and to have open conversations and really challenge each other on what needs to change, then you can make progress. We also know that most of the really brilliant ideas about how you solve issues around climate change in the healthcare system come actually from people who are practicing out there delivering services, all of you. And that's really, I think, where the ideas for change happen. And that's where we're really focusing our attention. So just to give you a flavour of what we're doing at the moment, we're working a lot with the Greener NHS team, looking at procurement, how you buy services through the system in their suppliers forum, but we've also been staging workshops to learn from each other so that companies can learn from each other, but also people in the large company supply chains can actually learn and challenge the companies themselves. We've been working with colleagues on an eco-design tool for low carbon clinical trials, led by the Institute of Cancer Research. We've been working with a whole group of colleagues through the TMP and others. And we've now moved on to look at what we can do around our case studies and detailed care pathways. And we've been working with Rachel's colleague Francis and others, Ms. Surin at the Newcastle Hospitals Trust, to really look in detail in a renal care pathway, and particularly haemodialysis, but we're going to be moving on to other areas. And we've also been looking at how can you apply our care pathway approach to other people's way of looking at innovation. So we've been working with the Academic Health Sciences Network to integrate our environmental impact work into their innovation case studies. And we're just about in a couple of weeks' time to launch a primary care calculator. We've been working, like everybody else, on COP26. We're actually an accelerator organisation for Race to Zero, which is where the climate champions are working with different sectors to really get change, and we're working closely with them. But as I've mentioned, what we've learned is that coalitions can help collect people, they can help encourage collaboration and understand barriers to change. And we're really keen to understand new ways to test and learn. So we very much welcome contacts from health professionals to work with us and to bring their problems, their ideas about how we can get change to us as a group. So it's a pleasure to talk to you this morning, and we really look forward to having opportunities to collaborate with you all. So at that point, I'm going to stop sharing and come back to the group, and then I'm going to introduce Anya, who's going to talk about health declares a climate emergency and building grassroots activists. So Anya, over to you.
Thank you very much, Fiona. And thank you for sharing my slides. You want to make them large, is that possible? Perfect, thank you. Hi everyone, my name's Anya Gopfer. I'm a doctor and public health registrar, and I've been involved in setting up and coordinating a network in the UK called Health Declares. Our full name is Health Declares a Climate and Ecological Emergency, and we are focusing on, as Fiona mentioned, building grassroots activists, so bringing people together across the country to work together on this particular issue. And I think the model that we've started is very applicable or replicable in other countries, and I'd be happy to talk to anyone who have any further questions. Next slide, please, Rachel. So the background, if you just click through so it all comes up on the slide, I think. The background to this is that the NHS has, well, it's been working on sustainability for a long time, but we started in 2018-19, and we really wanted to put pressure on the system, both individual NHS hospital trusts, so organisations within the NHS, and also royal colleges within the NHS to declare climate emergency. If you can move through it, just keep going. So we thought that there's role for bringing a large number of people together to support each other to work on this, because it can feel quite lonely working on this on your own, but actually there's an increasing number of people who are concerned and want to do something. So we wanted to bring people together, and you would then work together in a group to lobby either in your particular hospital trust for that to declare a climate emergency, or within your royal college. So in the UK, we have royal colleges for each specialty to declare a climate emergency, and then to take action after that. So divesting from fossil fuels being one of those things, setting up permanent kind of structures, so job roles, people who are kind of working on at least part-time, enacting plans to take this work forwards. So we wanted them to declare a climate emergency, so that's where the Health Declares an Emergency comes in, but then also to carry on taking action. Next slide, please. We've designed ourselves in what we call a hub and spoke model. So if you click again, we have a hub, which is kind of core group of people working together to coordinate from the centre, but there are many different groups that actually work with us and are pretty autonomous. So that we call the spoke model. So for example, there's a group in Newcastle, there's also specialty specific groups within the emergency medicine group. And if you just click again, Rachel, then we've got a wide range of people, including students. We've got a wide range of different healthcare worker disciplines, and they will also get together in their little groups. So I, for example, coordinate the Public Health Declares group, which is public health professionals working on this. Next slide, please. So if you want to get involved, or if you want to talk to us about what we do, we've got a website, and on the website you can make an individual or an organisational declaration of a climate emergency. I'll pop the website link in the chat after I've finished presenting my slides, and then you'll get an email with information about what you can do, and you'll be signed up to our newsletter, which includes all sorts of things that are coming up in the next kind of month or two. We also work very closely with, as I said, all of the spoke groups, and we'll be able to direct you towards the ones that are relevant for either your local area or your specialty. And we also work very closely with a lot of the other groups on this call today, so as we're all working towards the same goals. So the story so far, and I think these figures are probably a little bit out of date now, but there were, at our last count, 7 royal colleges declaring and taking action, 11 NHS trusts, 26 spoke groups, and we've got 8 specialty groups, 110 people in the hub group, and then about, well, over 200 individual members who signed up. And we're hoping to build on the back of COP and develop this organisation further over the next couple of years. I think people have really enjoyed being involved, and one of the things that we've been doing recently is just holding monthly drop-in sessions for people to come and bring ideas about things they're working on and maybe actually get support from other people. So they present a bit of something they're working on and people offer support and direction, or ideas or their own experience to help, so people really feel like they're part of a group of people working towards this. And I'm not going to read these quotes out on the slide, but basically people have given us really positive impact as a result of being involved. That's all I wanted to say today. So I just wanted to introduce you to Health Declares. Thank you very much for listening, and I'll pop a couple of links in the chat and happy to take any questions.
Thanks very much, Anya. That's great, and you've given us a really good introduction. So it's a pleasure next to introduce Rob Adams from MEDAC, and you're going to talk to us about the Green New Deal.
Great. Is it possible for me to share my slides? My own slides?
I'm sure it will.
Absolutely, it is. I'll stop doing it via this. Hold on.
Thank you. Great. Sorry, just bear with me 1 second. There we go. Hey everyone, good morning. My name is Rob Abrams. I'm the Climate and Health Programme Lead and Campaigner at MEDACT. And I'm going to talk to you very, very quickly about some of our work that's going on with our latest campaign, Health for Green New Deal. This presentation is what I like to call kind of a tour through the pictures on my phone, because it's essentially what it's going to be. I'm going to show you some pictures, I'm going to do some talking, but the stats are going to be in the links that I share at the end, basically. So just to talk a bit about what Health for Green New Deal aims to do, it aims to build a mass support in the health community for a transformative Green New Deal and support those working in health to organise for a just transition to zero carbon society. So what do we mean by a Green New Deal? A Green New Deal is a 10-year program, policy program for government that's based on these 5 principles of bringing about a fast and rapid decarbonisation, bringing about millions of good, well-paid green jobs and a just transition for those working in high emission sectors, transforming the economy so that our financial systems truly work for the needs of people and planet, protecting and restoring our vital habitats and nature, making sure that everyone has access to clean water, air, green spaces, everything that we need to ensure good well-being for all. And promoting global justice. So the UK is doing its bit to account for its historic role in exploiting communities and resources around the world, a bit like students of global health talked about before. I'll pop the links in at the end, but we produced this report, the Public Health Case for a Green New Deal, that kind of goes and explores some of the health arguments for these policies. Yeah, I really recommend that. I'm biased because I helped write it, but I do recommend checking it out. So what have we been up to over the last year? So about a year ago, we coordinated this letter with many of the awesome other organisations on the call today. About 1,400 healthcare professionals all over the UK signed this letter, 3 Royal Colleges, including RCGP, RC Psych, and the Royal College of Physicians, which called on the UK government and the COP26 presidency to commit to like ambitious reductions targets ahead of COP, and also accounting for that sort of global and historic responsibility that I've alluded to just before. More recently, we've been involved in the drafting of the text of this new exciting piece of legislation, which has actually just recently arrived in Parliament, the Decarbonisation and Economic Strategy Bill, aka the Green New Deal Bill. We've been working with the amazing team of MPs that you see lined up in this picture here to make sure that that bill really centres the need to address health inequalities as part of our tackling the climate crisis and social injustice more widely. So the text in that bill now includes some very interesting things. And if you have time, I really recommend going and checking out that bill, actually, if you're the sort of person who likes to read the fine detail of those kind of things. Has some very interesting stuff on the need to invest in universal high quality healthcare as part of our decarbonisation strategy. So making sure there is a very clear link between those two things. So we've been mobilising our local groups and activists around the country to take action for this Green New Deal bill. So we've had groups around the country who've been getting members of the public and people in their workplaces to sign these postcards, going to MPs, sort of encouraging them to back the bill in Parliament. So there's some of our amazing groups around the country. We've got Newcastle, Bristol, Plymouth, Liverpool. There's a Students of Global Health group there as well, doing amazing work in engaging the public, not only on the bill itself, but the health impacts of the climate crisis more widely. And that's sort of community engagement approach that we take to our organising. So a lot of this organising by our membership has led to the British Medical Association voting to endorse the Green New Deal and backing the Health for Green New Deal campaign at the most recent annual representative meeting, which is a very exciting moment. Can definitely say candidly that we were not exactly ready for this, but it was a fantastic thing, and we're now talking with the BMA about how we can mobilize more doctors around the country to have a bigger push around this bill in the coming year post-COP. Another thing we've been involved with recently, going more into our upcoming COP26 actions. Our members in Scotland have been taking action with an open letter they've drafted to world leaders, specifically from doctors in Scotland ahead of the climate talks in Glasgow. And much like that letter that we composed a year ago, it sort of focuses on the need for a just transition, and for the UK to take a real approach that centres global responsibility ahead of Glasgow. So there's some of our members who've been doing some incredible organising work in their workplaces and their practices and getting their colleagues out in support of this. And that is an ongoing effort. I believe they're aiming for 1,000 signatures by the end of the week, but we'll see if they get there. And off the back of that, some of our members have done this amazing visual action in Glasgow. They went around Glasgow last week and projected a message that world leaders simply could not ignore onto the side of the Queen Elizabeth University Hospital and George's Square and a few other landmarks around Glasgow. If you're on social media, you can check out Health for a Green New Deal on Twitter. We've shared some of more of the photos and the videos from that evening on there, so you can see some of the people who are involved in it talking about this and why they did this. And to focus on one of those images from the hospital in Glasgow, on 6th November, as I think Rhiannon's already mentioned from Students of Global Health, we're going to be marching. There's going to be health blocks joining marches for climate justice all around the country. I think we've got health blocks planned now in Glasgow, London, Sheffield, Leeds, Brighton, Bristol, Newcastle, London. If I've missed out your town and city, I apologise, but there are lots. So I really encourage everyone, if you're going to be around on Saturday, the 6th of November, join us on the streets, and I will share the link in the chat in just a second, like the others, just so you can have all the information and sign up for that. And also, if you're available on Sunday, the 7th of November, we're joining the COP26 Coalition and running this amazing event together with the People's Health Movement, Students of Global Health, Race and Health Collective, and a few others, where we're going to be all day. We're going to be hearing first-hand testimony from communities all over the world who've been impacted at the front line of the climate crisis and extractivism. So it's going to be a really, really powerful, moving day. We're going to hear from people who've just been doing the most incredible work in protecting their community. So if you're available on Sunday, the 7th of November, this is not one to miss, though of course I'm biased. So yeah, that was a bit of a whirlwind tour through what we're up to at the moment. But just to mention very briefly, it doesn't end at COP26. COP26 is if anything, is just the beginning. So we are hard at work on developing our organising strategy beyond COP. But here are some of the highlights that I can sort of share with you now of the sort of local wedge issues that our groups are going to be working on over the coming year, whether that's like on the left, our Leeds group working on opposing the expansion of Leeds Bradford City Airport, or in Sheffield fighting for better public transport with local community groups. We need to bring this local element to our organising and connect it to the global, the struggles that we face on a global level as well. And that's very much how we believe that we win in creating a world that is both healthy for people and planet. And before I warble on any longer, I'm going to stop there and I'll share the links that I promised in the chat. Thank you, everyone.
Brilliant. Thanks very much, Rob. And that's given us lots of opportunities to work out how to engage. So that then takes us on to Elaine from the UK Health Alliance on climate change. Look forward to hearing your presentation, Elaine.
Thank you. Thank you, Fiona. Thank you, Rachel, for sharing. My name is Leah OCallaghan. I'm the director of the UK Health Alliance on climate change. And so I'm just going to talk to you today, as everyone else has done, about who we are as an organisation and what we're doing and how you can get involved with us. So the Alliance, the UK Health Alliance on Climate Change is an alliance of health organisations, as we all are, with a common goal to address the health impact of climate change. Our membership includes royal colleges, associations, societies, mainly healthcare organisations, and also we've got a number of journals: British Medical Journal, the the British Dental Journal, the Lancet, who are members as well. I'm sorry, can you go back? Sorry, thank you. So in total, with all of the membership pulled together, looking at how many of those like royal colleges, big, small, all different sizes, in total we represent coming up to about 1 million healthcare professionals working around the UK, and we also work quite closely with a number of other organisations, all these on the call today, and also the Global Climate and Health Alliance, and where we speak to people in Australia about work that they're doing. So more broadly as well, on an international level, we're representing the voice of the UK health community in these global campaigns. Thank you. If I can go to the next slide, please. So in terms of what we do, so our work really spans advocacy, campaign work, some policy work, and shared learning among healthcare professionals. Some recent examples of work that we've been involved with include the coordination of a health editorial that was simultaneously published in over 220 international journals, and hopefully most of you have seen this. There's two key asks that we've been really pushing for in the lead up to COP26, and these have been around a commitment from world leaders to limit warming to 1.5 degrees, and also for the wealthier nations to contribute and to transfer funds to the lower income countries, because this is a global issue, and the wealthier nations need to support the lower income countries if we're really to have any global success with this. They've been a really key ask, and there have been a number of campaigns that we've really been pushing this message out. It started with the health editorial on the 6th of September, and currently there is another letter which we've been working with in partnership with a number of organisations, including the World Health Organization, the Global Climate and Health Alliance, and others. And this is really to mobilise the world's healthcare professionals on a global scale to call for world leaders attending COP the next couple of weeks to make these commitments. And they really are focused on these key asks about making commitments to limit warming, and also for those transfer funds from higher income to lower income countries to make it happen. That's our ask. There's a number of there's a lot of activity going on. You can still sign this letter. It's been signed already by about 400 healthcare organisations around the world, and thousands of individuals have signed the letter as well. I will put a link to that in the chat afterwards. If anybody hasn't signed or want to add their name to that, then please do. The letter will be delivered into COP next week. There's a team of paediatric health professionals who are currently cycling on the Ride for Their Lives, which I'll also send a link to. They started in London on Sunday, and they're cycling up to Glasgow, accompanied by some pollution pods, where they will stop in cities along the way with these pollution pods, where people can actually go in and experience different levels of air pollution in different cities around the world. So they'll get to Glasgow and they will deliver the letter into COP on behalf of the world's healthcare community. In terms of learning and shared learning and working together, we work with all of the other health organisations that are on the call today, and a number of others that I've mentioned. And we also we can connect in with government and we've been providing a link between government and our members. A good example of this was we recently facilitated a meeting between the UK Cabinet Office, who are responsible for the delivery of COP26, and a number of our members, our council members, who are presidents, vice presidents of royal colleges, and so on, and other organisations who are concerned about running huge grand scale events such as COP in Glasgow during a pandemic. And that was a really good opportunity for the health leaders to really question the government on what they were doing and making sure the event was as safely delivered as possible, because there has been a lot of concern in Glasgow. I live in Glasgow, and there's a lot of concern here among the healthcare community in terms of the issues in the hospitals just now, which are beyond capacity already with COVID cases and the impact of COP and all of that. Other work that we're doing, we're frequently write to government, so issue our support for bills. Recent examples are the CEE bill, which is up for second reading this week in Parliament, and the Environment Bill, which was rejected last week, going through Parliament. And over the next few weeks, we'll be setting up a net zero surgery commission, working with partners across the UK. This will involve recruitment of a fellow to lead this work. It's a Health Foundation funded post that we've secured grant funding for, and we'll be putting out an advert for that soon. So anyone who's really interested in surgery and climate and how surgical practices impact on climate, do look out for that job advert, and that will be a 2-year fellowship to lead on this net zero surgery commission that we'll be putting out. So just to finish, just if yes, please, sorry, onto the next slide. What you can do is you can join us. So if you are a member of an organization who wants to get involved with the work that we're doing, then please do speak to your teams and see about joining the UK Health Alliance on Climate Change. We're very inclusive. We have different rates for different size organisations, and the type of organisation you are, whether you're new or you've been in existence for a long time, we do try and make it as accessible to everybody. You can get involved by supporting our campaigns. Please do add your signatures to the Healthy Prescription letter. Get involved in events, find out what you can. Find what stimulates your interest and get involved in making sure that the voice of the health community is heard in the conversation around the need for action on climate change. And that's our Twitter handle there as well, and our website. So I will stop there and pass on. Thank you.
Thanks, Elaine, that's great. And also thanks to you as an organisation, because the Alliance brings us all together as organisations monthly so that we can compare notes and really understand how we can promote action together. So that's been a huge addition to what we do. So last but absolutely not least, it's a pleasure to introduce Manraj from the Greener NHS team. So over to you.
Great, thank you. I'm happy to share my slides if that's
I'm just going to ask if you wanted to, that's fine.
Great. That's me. Brilliant, so I hope you can all see that. Sorry, all your faces have disappeared. Guessing you can.
Yeah, we can see it.
Brilliant, brilliant, thank you. So yeah, thanks so much. I'm Manraj, I'm not Nikki, obviously I'm doing this on behalf of her, so thanks for having me. I'm one of the Chief Sustainability Officer's Clinical Fellows. I'm a urologist in training, so very interested in that surgical fellowship. It's great to see so many coming up. So I'm just going to talk you through a little bit about what the Green NHS is doing and how it's working towards delivering a net zero NHS. So why? I mean, we've all covered this to a great degree in everyone's talks. Really, climate change is one of the greatest threats to health, but actually one of the opportunities that we have to make a change and to really harness those co-benefits of tackling climate change. So benefits to health, environment, social, financial benefits, such as that triple bottom line that was mentioned earlier. Sadly, the NHS is both part of the problem, the challenge, but hopefully also the solution. Our UK emissions just from the NHS comes up to about 5%, but we've got a huge workforce that if we manage to engage and infuse and equip can actually have quite a lot of traction in this. So we've got 1.4 million staff to get on board. So the Green NHS's vision was really, it's been committed to delivering the world's first net zero health service. And that was marked by this landmark report a year ago, so October last year, around how we work around delivering a net zero NHS. And in that report, it set out 2 ambitious but hopefully feasible targets of hitting net zero for emissions that we control directly by 2040, and that's that NHS carbon footprint. And then for those that we can influence, so that huge supply chain that's already been mentioned, the NHS carbon footprint plus by 2045. And there's some midpoint targets there as well. So how the Green NHS, which obviously is a national programme, went about doing this in the report is setting up an expert panel and really highlighting of the first sort of really comprehensive carbon footprint of a health system, looked at the projections if we were to do nothing or if we were to do quite a lot, and then how we could harness carbon reductions across the system, what interventions would be needed, and to really stipulate a national roadmap of achieving this net zero target. So the first element in the report, which I'd really encourage everyone to read if they haven't already, is this carbon footprint highlighted by these greenhouse gas protocol scopes. So the NHS carbon footprint itself, which is directly in our control, such as anaesthetic gases, our fleet, the electricity we use, and then the NHS carbon footprint plus, which includes that supply chain, but also transport and travel of our huge amount of staff and patients and visitors as well. This really stipulates and highlights where these hotspots are, a lot along the supply chain here with our medical devices, our medical equipment, travel, both of staff and patients, looking at those anaesthetic gases and metered dose inhalers, where there's been a lot of work done over the last year, and then our estates and facilities. This little diagram here on the right really highlights that it is cross-cutting across all activity levels, and the bubbles show where the biggest hotspots are. And that's where I think that work on the pathways is really important, because it feeds into all of these areas. So we've just sort of celebrated our 1 year on leading into COP as well, and I'm pleased to say that we're on track as per the last public board meeting. We have managed to reduce emissions by 1,260 kilotons of CO2 equivalents, which may not mean very much to many of us, and me included sometimes, but that's enough electricity to power 1.1 million homes. So we are getting there together. We've also done a recent survey that does show that there is this grassroots movement. NHS staff want to get involved. They do appreciate the importance of this, 9 out of 10 being keen to take action on climate change. There's a huge greener NHS community, and that's one of the ways I would encourage people to get involved, and I'll post a link in the group. And we've got over 155 trusts and ICSs signing up to their green plans, which should be in place by next year spring. And then, as already mentioned, with many other organisations on this webinar, working towards getting that net zero supply chain. So we've got multiple work streams working across the Green NHS programme, and there's been lots of highlights throughout the year. One is that supply chain, so we will no longer, by the end of the decade, purchase from suppliers that are not aligned with our net zero ambition, and they've really highlighted a good roadmap, and I won't go through that because it is publicly available, and that's really important when we think about working across the globe with those supply chains that transcend not just beyond us. Estates and facilities, lots of investment coming in on renewable energy generation, energy efficiency measures and lighting, and Milton Keynes is one of those great sort of case studies of how to do this, with over 2,500 solar panels put in. Travel and transport work, really working towards non-emergency patient transport being net zero, with a recent review that's come out. And then more active travel and innovation with case studies from Oxford, for example, using e-bikes as couriers for chemotherapy. There's also going to be the world's first hydrogen electric zero emission ambulance coming, and that's going to be featured at COP, so look out for that if you're going. A huge amount of work in the medicines field. 5% of our footprint is from inhalers and anaesthetic gases, and a lot of the anaesthetists in this field have done a lot of work with reducing the use of desflurane. With regards to primary care, there is incentives now for prescribing low carbon inhalers. And there's movement across policy, really, with this overprescribing review that came out not so long ago. So leading up to COP, obviously, which is a really important time for us to build further engagement and drive bolder commitments. There's going to be lots going on that's in the pipelines. And really how you can get involved is to really use this policy or this unique point to drive change, and share ideas, collaborate, and get involved with the Green NHS community, where you can share ideas, case studies, and really learn from what's happening already, so you're not reinventing the wheel, because time is of the essence. So I've just put some links there and our Twitter handle that you can follow after this, and feel free to contact me if you've got any specific questions. Thank you.
Brilliant. Thank you so much. That was a quick whiz through, and we are, believe it or not, almost at time. I think we've covered most of the questions. I know that Rachel will be able to send out the chat to people so that we've got the links, because I know that we covered a lot of information in a short period of time. There have been some fantastic comments around the importance of mental health and keeping everybody going, and I know that working together as a group of organisations helps us all go faster, and it's great to know that you're not alone in this. So I think that probably means that we've covered most of the questions. I'm just reading at the same time. There's also question and answer in the Q&A, Rachel, as well, which we could try to capture.
Yeah, it's an interesting one about
end of life.
End of life, beginning
yes.
Of, yeah.
And I know that a lot of the Greener NHS team in its predecessor, the Sustainable Development Unit, they did a lot actually at looking at interventions at different parts of the life cycle. So I just want to finish by thanking everybody for their fantastic presentations. You'll have noted that there is another seminar later today where we're actually going to be covering the same materials. So if you've signed up for both, which we know some people have, we'll only be covering the same material, but if you want to come and hear it all again, we'd love to have you with us. And thank you for bearing with us for some of the technical issues, but as you can see, our enthusiasm far outweighs any of the problems that we have with technical issues and slide sharing. It's only a small blip on what's a much bigger journey. So thank you for your interest. We look forward to working with you on the next steps, and let's make sure that we accelerate action to COP26, but more importantly, after it. So thanks very much to all our panelists, particularly for keeping to time, and thank you to all of you for participating and asking such brilliant questions. Okay, thank you very much.
Thank you, Fiona. And we will share slides with everybody and the recording of the whole thing, so don't worry.
Thank you very much, everybody. Bye.
Thank you.